Hello again, this is Ross, the HR boss with MRA, the Management Association, answering your workforce questions. And I have a letter today that I'm sure is on the minds of many of you. Dear Ross, thanks to MRA's suggestion earlier this year, I sent out a letter to employees with some general information about healthcare reform. Although I haven't been getting many direct employee questions about this topic, I have heard through the grapevine that employees are talking amongst themselves. Apparently, employees are worried that our company may decide to pay rather than play. Others think that their employee contributions may double next year. I don't want to make a mountain out of a molehill, but I don't want those rumors to get out of hand either. Any suggestions? And it's signed Headaches in Hudson. Well, you know, headaches. In the absence of information, people start talking, right? Rumors happen. And generally, rumors are far from the truth. The best way to deal with rumors is to inform. Make sure that your employees know the following. Explain that because of the complexity of the new regulations, some of those regulations may be unclear, and others are simply unknown at this point. Encourage them to check out a few websites. For example, one is www.kff.org. By the way, KFF stands for Kaiser Family Foundation. Another one is www.healthcare.gov. In both these sites, they can get clear, accurate information. Both websites are helpful, and KFF is quite clear, and healthcare.gov, by the way, is the official federal site. So I would highly recommend that one too. Don't forget to use various types of communication, such as emails with links to helpful videos, articles, bulletin board postings, and so on. Here's my other suggestion. Use the 3 R's to get the biggest bang for your communication buck. They are reassure, repeat, and renew. Reassure employees that you are keeping up with the information as it becomes available and that you will continue to provide a competitive benefits package. Repeat that message and new information frequently. Use those various methods of communication that you've used in the past and were effective for you. Don't forget to use your upcoming open enrollment period as another opportunity to communicate. And finally, renew the importance of wellness. Tell your employees that this is part of the Healthcare Reform Act. It's another opportunity to communicate information perhaps about your own company's wellness program. And by the way, if you don't have a wellness program now, guess what? MRA can help with that too. If your company has decided to not provide coverage or to discontinue existing coverage for employees, it'll be extremely important to communicate that to employees when that decision has been made. And then to include helpful information about how they can obtain coverage through the new exchange program. And here's the good news. You have help in all this. Make sure to contact MRA. We have all sorts of resources, webinars, toolkits, our resource library, and the professionals who staff our call center to make sure that you have the latest and the greatest information to pass on to your employees. And let me leave you with a closing thought that you can communicate to employees to help encourage them to be wise healthcare consumers. The healthier we are as individuals and as a group, the less likely we are to pay high health care costs. Well, here's to your good health. Until next time, it's Ross, the HR boss with MRA, the Management Association, wishing you an engaged and a healthy workforce.